Hi everybody. For those of you who do not know me yet, you can call me Kid. And those who do already call me Kid. Today we're going to talk about something that's very important. It's low back pain, and it's something that such a huge amount of our population deals with, and there's so much controversy about what actually works and doesn't work. And I've had clients that have suffered for years with low back pain that have gone through physical therapy for up to even 3 years once a week and still just kind of keeping their symptoms at bay. Okay, what we're going to talk about is addressing the issue, why the low back pain is there and what could be done about it, okay? There's two things that are very rare. One is a kidney infection and the other might be like a fractured rib. Those are things you'd want to see a doctor about. Those are things you'd have to deal through that. Okay, those you can tell pretty easily. If it's a kidney infection, you'd have a fever. If it's a cracked rib, tapping or vibration anywhere in your ribs, you will feel a very specific point that hurts and hurts bad. And you'll know that that's a fractured rib versus a muscle pain or muscle injury, okay? So now, the main common reasons for low back pain are muscles and the tendons that they attach to. Sometimes they'll pull on those tendons and create inflammation in the tendons. So one, iliopsoas. The iliopsoas muscle attaches right at your groin, at the base of your leg, and it goes on the inside of your hip bone, and it goes to your low back, right at your lumbar vertebrae, okay? And it comes up, and what it does is it pulls that muscle from your back all the way through, and it lifts the leg up to be able to pull your knee up to your chest. That's the action. So when you're standing up straight or laying on a bed facing upward, now that iliopsoas is in a full stretch. So if that iliopsoas has any muscle damage, you're going to start feeling it in your low back. Sometimes in the groin, but generally first you're going to start feeling it in your low back because it will start to pull those vertebrae out of place and out of position. Okay, now one thing that's important to start with too is the muscles, like the iliopsoas muscle and all of the muscles in your body. They connect and interlink on a microscopic level like this, and the fibers have to slide back and forth on one another. Now that's what makes the muscle be able to lengthen and shorten. But now when you tear, whether it's micro tear for repetitive use or whether it's like a major tear from like a fall or an accident, the same thing happens. Fibers lay down, but they lay down randomly. They don't lay down all lined up to slide. They lay down randomly, and they generally will lay down and kind of lock into like a patch unless that muscle was moving. Like say you stretched after your accident or you stretched after working out. As the muscle's moving, those fibers will lay down and pull into line, no injuries. Lack of stretching, you start to create these patches. These patches shorten the muscle, pull it in tight, and make it so that now that muscle doesn't have the give. Instead of sliding, it's now kind of locked down. You hear physical therapists say, oh, that muscle's weak. It's not really weak, it's just tied up. Like if you had a real strong guy and he was tied up, you wouldn't be able to see how strong he was because he can't move. That's the same thing with the muscles. So now the iliopsoas muscle, if you've got those patches, that muscle's shortened. So you're going to find the symptoms of that are, like we said, standing up or laying on your back, you'll feel aching in your low back. Or when you go to get up out of a chair, you have to get up slowly because the back hurts as you come up. Definite sign it's iliopsoas. So now when you know what muscle it is, you know the action, now we can stretch it. I'm going to have some stretching videos very specifically for iliopsoas, for the other different muscles that I'll be putting up on YouTube later that you'll be able to look up under Koontzin. It's a technique that we use for correcting the muscle injuries. Number two, gluteus medius and minimus. They work together. They're right on the upper side of your butt cheek. And what they do is they stabilize your hips when you walk. So when you lift one leg, the other one has to stabilize, and that's when you use that muscle. So a lot of people that are athletic and in the gym end up with trouble with this. A lot of times people confuse this damage to this muscle, the pain that it creates, with sciatica, because you can also get a pain down your leg like you do with true sciatica, but it's a peroneal nerve, not the sciatic nerve causing it, because it's a gluteus and minimus muscle that's impinging that. And the difference is it goes down the side of your leg, kind of wraps into your knee and down to your ankle. Okay, so that's different than the sciatic nerve is straight down the back side of your butt, back of your calf, into the bottom of your foot. That's the difference. So this one with gluteus and minimus, this one, when it's hurt, you can tell when you're walking. Like say you get up and start taking a few steps, it's called the gluteal medial limp. You kind of like have to, we call it our hitching your get along sometimes, it's referred to. That's from that muscle. And it causes pain that kind of goes like from your sacrum out to the side. So sometimes you can have it on one side, sometimes you can have it on both sides. And so that's also a low back pain issue. And look on YouTube under Koontzin for the stretch for the gluteus minimus and medius, and we will show you how you can get rid of that and reverse that out. Just like with the iliopsoas, we need to line those muscles up. We need to free them up so the muscle can work fully again. Number 3, the erector spinae muscles. Those muscles hook from your sacrum at the bottom, go all the way up to the back of your neck. These are the ones that hold your body up erect. And you're going to notice when these are giving you trouble is anytime you go to lean forward or slouch and you get sharp pain in your back. Sometimes it'll give you a slight pain off to one side towards your hip, but it's still part of those muscles that run up and down. Many times our pain isn't exactly where the muscle is creating it, but it's a referred pain and it shows off to another area. But in all people, all the referred pain areas are the exact same, so it's easy to identify. Now, that again, the erector spinae muscle, that one is going to show more off to the side pain, like to the ribs. Sometimes it's the one that's confused for kidney pain, and then also down lower towards your hip. That's another area. And the way you can tell that it's that muscle. So again, look up Koontzin, Koontzin on YouTube, and I'll have a video for the stretch for that as well. Okay, last but not least, the quadratus lumborum. We call it the QL for short because it's a big word. Now, it hooks to your hip bone and then up to your ribs, and it moves you side to side. A lot of times shoveling, raking, lifting things up onto a truck, they're real common things for people to injure. It's one of the most common muscles to get injured, and it pulls you off to one side, and it's one of the main culprits also to create hernias, where your disc will slip out to the side. Now this one with the erector spinae, with the quadratus lumborum muscle, the symptoms for that are pretty easy as well. If you go to lean forward, like to brush your teeth, and you feel like a grab in your low back, like it makes you want to drop to your knees, it's so painful. Or say you go to look at your hair, anything that makes you slightly lean forward. Now you lean forward all the way, but to slightly lean forward and hold, that's when you know it's the quadratus lumborum that's giving you the trouble. One thing that helps is if you lift your foot up and you set it up on something in front of you and then you lean forward, it's not going to hurt. And that's another definite for sure showing that it's a quadratus lumborum that is giving you that trouble. The pain from the quadratus lumborum goes right from the low back down into your butt cheeks. And you feel it very strong right in the butt cheeks. And it's one of those that people go to the emergency room, people are getting heavy medication and shots. Sometimes you can be laid up for weeks, even a month in bed, unable to move because of this one muscle giving you the issue. That can also be corrected out. Just like we talked about those fibers that aren't laying down the way they should to have the mobility, when this muscle gets tight, throws your whole body out of balance and is going to create that referred pain area that you're going to feel. So again, YouTube under Koontzin for quadratus lumborum or QL stretches. We'll put some in there to help you to be able to get rid of that and to clear that out. If you're not able to do it with stretching on your own, we can also talk about doing some treatments to be able to correct it manually out. But that's it. There's those 4 main muscles that are going to give you low back issues. They're not very difficult to fix, and there's a lot you can do at home just through stretching to free those muscles back up, give them back their length, and then you can move again free and easy and comfortable without them. I hope you enjoyed being able to learn how those muscles can affect the back pain and how you can tell which ones they are. If you like this information, if you'd like to know further information about this, press the subscribe button down below, and you can press the little bell if you want to see when I'm releasing another video. We are going to be putting out quite a few more because there's so much misinformation out there. We want to get you results, and I want you to be able to live without pain. All you out there in Internetlandia, we got news for you. We got information for you. It's an earthquake. Hold on, everyone. Okay, we survived. That was a little rough there. I think we're still recording though. Okay, we got good information. We got bad information. But the bad information is not coming from me.